If I would rebuild TheraNow, I would focus a lot less on innovation and a lot more on integration. A lot of founders like us, we start building product first. We're building a house, but we don't have a power, water, sewer. Healthcare doesn't lack innovation. It lacks implementation. If your tool requires a massive behavior change, adoption fails. If it reduces the workload inside the existing workflows, ROI follows. And that's the key. We're focused on building infrastructure inside health systems, not just softwares.
Welcome to the Entrepreneur's Logbook podcast. I'm your host, Zachary Bernard. You can find me on social at It's ZachB. In each episodes, I bring on experts from various industries to learn about their strategies and insights driving extreme business growth. Today, we're joined by Dr. Ashok Gupta, founder of TheraNow, a virtual therapy platform delivering physical, occupational, and speech therapy across the US through a network of 400 plus clinicians. Ashok started his career as a practicing physical therapist, including working with veterans at VA hospitals, where he saw firsthand how broken access to care really was. That experience led him and his wife, also physical therapists, to build TheraNow in 2017, at a time where virtual physical therapy basically did not exist. Since now, they've actually supported over 70,000 patients and partnered with major health systems, including Providence Health and Ardent Health Services. Ashok also holds a degree in digital health and health information technology from Harvard Business School, and he's also the host of the Edge podcast, so a fellow podcaster here. But Ashok, it's great to have you on the show. Well, welcome aboard.
Thank you, Zach. It's a pleasure being here today.
I love it. So one of the things I always love to do here is this is obviously a business entrepreneurship podcast. We want to give back to the people. You've been in the space for quite a while. You've built quite a few things. We've obviously talked off the mic about all the interesting things that you've done, even scaring Microsoft at some point in your career here. But what I'd love to hear is if you had to like rebuild your company from scratch, like right now, knowing everything that you know at this point in time, what's the one thing that you would do differently that you feel like a lot of business owners, entrepreneurs get like totally wrong?
Right. Now, that's what a great question to start out this great conversation we're going to have today. So, if I would rebuild TheraNow, I would focus a lot less on innovation and a lot more on integration.
Okay.
So, you would say, especially in healthcare, uh, if you're not integrated deeply into your distribution workflows or you're not deeply integrated in your data pipelines, how much ever good of a product you're going to build is going to be isolated. The best and
Mm,
easiest example I can give you out here is like you're going to start building a house. First thing you would do is like bring the utilities to it before you even put the foundation, before even you do anything. A
yeah.
lot of founders like us, and even I including myself, we start building product first. We're building
Hmm.
a house, but we don't have a power, we don't have a water, we don't have a sewer. And this is what the integration is all about. So first you need to build the integration pipeline. You need to know which health system, which what will be your delivery mode, and how are you going to actually like put your product right into the hands of the consumer, which generally is tied into a large, big tech driven technology infrastructure where penetration is very, very hard.
Hmm. Interesting. And I feel like I'm not sure if that's like that the best example, but you have like so many entrepreneurs, they're gonna like start a business directly like, oh, we need to create an amazing product. We need to just go out there, maybe create a fancy like website and everything like that. But you don't even have like the correct structure to begin with to be able to offer that to people. And that's where I feel like the MVP concept somewhat falls into place as well in a little bit. But you have to know like exactly like, okay, how am I going to integrate everything together so it intertwines and fits like perfectly versus just having piece of the puzzle like everywhere and like nothing like falling into place at the end of the day.
Yeah, absolutely. Healthcare doesn't lack innovation, it
Yeah.
lacks implementation. And that's what
Yeah.
the key is. So you can build a small MVP, but if this MVP is not integrated with like your host EMR or EHR, or
Hmm.
it's not able to fetch the data or push it back, or if your clinicians have to actually leave the software and get onto this like standalone website, which
Hmm.
in normal tech works,
Yeah.
because all we are saying is like for the period of time you have to log in into a different website, that's okay, But when it comes to clinical workflows, you're asking to break the workflow and
Hmm.
then build the workflow for your little tiny MVP that you think is going to be your next big baby that you're gonna change the world with. So that's
Yeah.
where my personal advice to myself is like, if I have to rebuild my company, I'm going to focus a lot more about my distribution strategy, my integration to the different platforms, and an
Yeah.
integration to the workflow itself.
Yeah, because I feel like with like healthcare specifically, when you talk about certain systems within like healthcare organization, etc., they're typically going to be like the same. Like it's not going to change like very heavily. I mean, I know like Epic is
Mhm.
like one of like a very big one that everyone knows in the space. And if you're trying to like build so many different things and they're not being integrated within what's actually being used at the moment, they're not going to be used like anyway. And you're just building something that's born to fail, to put it very simply. And it sounds like you've learned from like some of those lessons from what I could tell here.
You picked it so perfectly, actually. Like, unlike many industries, like the concentration of the big player, like Epic is one of the names, is like
Hmm.
so highly concentrated from an EMR, EHR market. If you're building an enterprise suite product and you're
Yeah.
not, so you're such a good spot right now. Either you're going to be in a very difficult situation that you can't really do anything without Epic, or
Hmm.
you can be other one. Now, because you're integrated with Epic, you don't really have to worry about anything else because half of the market share is already connected to you.
Yeah. I mean, it's like the much more efficient way to do that versus going another route here. And one of the things I'd love to dive in, because I know we talked about there and now we didn't dive like too in depth into it, but there's a big thing around what you guys do. It's virtual physical therapy. And you hear that directly. And like the first thing probably a lot of people are thinking, there's like some skepticism around it. They're picturing maybe a basic video call. They assume that's not going to match the same level of quality that you would get in person. And I'd love to hear your take on that. Like, where does physical therapy genuinely deliver great results? And where do you feel that sometimes it can fall short? Because obviously nothing is perfect, but what you guys have built is pretty interesting. So I'd love to hear that.
Sure. So the skepticism makes total sense. If the virtual PT is just about a Zoom call, it
Hmm.
won't work. But the real virtual care isn't a video. It's a structured programming, remote monitoring, clear escalation when the patient doesn't actually fit well with your virtual care product, and then have a hybrid or omni-channel presence of the care where a patient can go in person and get treatment what they really need. Where
Hmm.
it works the best is like access-driven scenarios like post-op follow-ups, chronic MSK care, rural patients, and continuity between visits. Like
Hmm.
access itself is a clinical variable. A lot of time we think the clinical services are what we render, but just being able to be available itself is a clinical, very big and important clinical variable. When
Hmm.
care is delayed, outcomes worsen. So it
Hmm.
doesn't replace in-person care, it extends it. The real
Yeah.
opportunity is hybrid models and omni-channel experience. So our focus has been always about distribution of care via virtual first or primarily virtual at the core, but the experience to our consumer and our patients has always been via the partnerships with the health systems, a large health system. We have a very good physical presence, so
Hmm.
you could actually start your first visit in the clinic and then have
Yeah.
like 3 weeks of care online and then go back to see the same therapist in the clinic. And we'll pick up right from there because we both are well integrated, not only from the workflow, but also from the data point as well. So we're charting on the same record and same episode of care. You don't have to be starting all over again.
Yeah.
Like because you're moving to different mode of delivery, you don't have to restart all over again.
Interesting. Because I feel like some people they'll just go maybe to like a PT. Like they're trying to get help. They go to a PT and then they're like, okay, I mean, need some like a follow up, just check in, make sure that like we're all good to go and everything's rolling. Like, hey, I need to go like in person. But nowadays, with like the model that you're talking about, you're able to be so much more efficient where you can look at online, have that hybrid model and be able to get advice and input based on that. And you're still getting advice and input from like a clinician. I mean, you mentioned like your platform, there's over like 400, which is quite a lot. And that was like across the US, if I got that correctly.
Pretty much heavy
Yeah,
concentration on West
heavy.
Coast, but
Yeah.
yes.
So like a lot of those clinicians are like available in the US. Like some people, and we'll dive into that in a second because I want to touch on to like AI too. But some people they'll think like, oh, AI. I mean, I'm getting recommendation from an AI, like what I should be doing. Like I could just use
Mhm.
ChatGPT to do the same thing, but it's much more deeper than that. And I'd love to like understand before we dive too deep into like AI. I'd still love to understand like what's kind of the difference when you look at like that hybrid model versus someone just getting advice on like ChatGPT or anything like that. And I know it has more context with
Right.
your current situation, your records, and everything like that. But I know you guys have something pretty interesting that you guys are doing.
Oh,
So,
definitely. The main difference is at the core principles of how you deliver care. So
hmm
you're taking an extreme example of like comparing
yeah.
what we offer at TheraNow is where our services are centered around physical therapists
hmm
providing the best clinical care needed for your specific condition, not for back pain, for your specific back pain, because your body is
mm
different, your condition is different, the way it actually came is very different. You can try to standardize and put into some algorithm, but still it's not to you. So that's where like the treatment has to be very specific and custom. The way we leverage technology or AI is to augment your effectiveness as a physical therapist.
hmm
You're providing you are still the primary intervention. All the other things, like for example, remote patient monitoring, the ideology behind that is not like you treating yourself when the therapist is not there. It's more about you providing the right and more critical pieces of information to the platform so that when the physical therapist is actually providing you care, they have all pieces of information and then they
yeah.
can provide the best possible care to you because of that. Uh,
Oh, but
and then same thing goes with the AI. Artificial intelligence, you can start think like, so there are some products actually, they're built for masses, but they
hmm
aren't built for physical therapy. So the difference between the built for
yeah.
masses is like you could use it for early intervention or for mild issues or like for fitness or wellness.
hmm
That's what the masses or direct to consumer products like. You can engage with technology by yourself, be able to deliver some value to yourself. But when you are really a patient,
hmm
things are very different.
Oh yeah.
It's medical care driven by a physical therapist, augmented by all the pieces of technology.
hmm
When you're talking about the chat GPT health or Claude health for per se, you have questions, and instead of waiting and then talking to the physical therapist or your
yeah.
physician and then getting answers, I love it. You could just connect your health data, give enough context, then be able to ask questions like, instead of googling everything which in 5 minutes will end up to the cancer, um, you can now have a lot more relevant feedback to your
yeah.
questions. But when it comes to the real intervention
hmm
or treatment, that's where you really need a clinician in the play. In our company, keeping the clinician first is our principle.
hmm
But we are the biggest consumer of AI today, or builder of AI into our domain. And the only reason behind that is we're taking a small pieces of our workflows and
hmm
then replacing them with AI if it doesn't really need cognitive load of the clinician itself. We can replace it, we'll replace that part, but so that we are allowing our clinicians to perform what they perform the best, which is the
hmm
clinical care.
I like that. And I feel like one good example to touch on to like the ChatGPT example is one of the things you'll often do is you might go ask it a question, be like, yeah, like I have this pain here, like what could that mean? But in the end, will you strictly take the information from the AI and act upon that? Probably not. You're probably gonna make a list. And when you go to your physical therapist, then you're going to be asking them the questions because you want to hear it from the expert, from those people. So it's a tool to be more efficient, but with having that more of that personal touch with you guys, obviously having all those records, you know exactly the current situation. So when you go back to the PT, even if you've had some back and forth with your platform, there's all that context, much more context into play. And you're consistently updating that as you have like these going on, maybe a new condition or anything like that. So it's a more hybrid model, as you were saying here.
Correct.
And
Yes.
one of like the bigger conversation that we talked about, we touched a little bit on it here, but specifically is AI within healthcare specifically. I mean, there's so many things going on a lot of people are like nervous about it. Like, oh, is it going to take my
Mhm.
job? Is this going to be a privacy issue or anything like that? In some cases, it could be because they've had a bad experience, or they felt that some tools were like intrusive, or because there's this like underlying fear again that's going to like replace them. How do you think about that? And like, what does AI look like when it's actually done right? Because I know that you're a
Mhm.
big proponent of AI. You see it as a way to have clinicians be more efficient and deliver better care. And I'd love to hear it from you.
Right. The way we think about AI is simple. It should reduce administrative friction, not replace clinicians.
Hmm.
When you let that sink in, everything is so easy to understand. Is like you're not trying to go tomorrow and have a session with your doctor or your physical therapist where you're talking to a machine and it's not the human. That's where like every time you think about AI and then people start portraying that type of picture, that's not how it is. We need to first understand ground realities. Is like AI is very, very, very effective when you're actually trying to reduce administrative workload, which
Hmm.
clinicians were not supposed to do to begin with. They were supposed to be
Yeah.
treating, but in order to keep good documentation, to get paid, and working in this deep healthcare industry, you have to do certain things that really is not direct benefit to the patient, but it's good for system altogether.
Yeah.
I think fear comes from the bad implementations.
Hmm.
A lot of early AI tools felt intrusive or
Yeah.
tried to replace a clinical judgment. And now that is actually like bad taste a little bit in your
Yeah.
mouth. So everyone is like documentation burden, coding accuracy, compliance checks. That's
Hmm.
where AI is adding value. But on the other side, I want to look on the things that it can do. It can take away my job. It will replace me. Those
Yeah.
are the things we were focusing on, not the ones where we really get the value out of it.
Yeah, and I love that you mentioned that like clinician, PTs, etc. They were like in this role to better help patient, but a part of their job that is like a must that they have to do is the admin side of things. But if you're able to like streamline that, remove that from the process, have AI or anything like that do all that for you, they're able to serve more patients, put more of their time towards that to provide better care. And it just ends up being like a win-win for everything, for everyone else. And like the side of things for like the patient themselves, I mean, the experience is going to be even much more smoother. You're able to provide new information about your current situation. So when you go to the PT, the clinician,
Right.
or anything like that, they have more context. And I feel that's like so important because sometimes like maybe I'll have something going on with my back hurting or anything like that. And I'll have to like remember what the pain that I had a month ago that's now gone, but that's going to come back in like 2 weeks. And then there's like no, that disconnect with like the context and just having that consistency with the information. It's like a really important one. And I know we didn't touch too much on this, but I'd love to hear it because with healthcare, I feel that's probably a very big one is trust, specifically with like data, AI creating a hallucination. There's like the compliance risk and everything like that. And a lot of people are like, can we actually like use this? Is this like trustworthy? And I'd love to hear how you guys go about addressing that. And what does it actually take to build an AI tool that health systems and clinicians feel confident like putting into their workflows? Because I know I mentioned some like pretty big like healthcare systems that you guys are like currently working with, and I've heard of like other clients who've talked about like Epic and everything like that, but never any like major health organization system like 50 plus hospitals, everything like that. So there has to be like some sort of secret sauce here that we didn't touch on.
No, there is no secret sauce. The concern is actually valid. Large language models are probabilistic, so you don't deploy them unsupervised in any clinical environment. The key constraint, uh, guardrails, structured output, retrieval from verified data source, audit logs, and human oversight. And
Mhm.
many more things I can talk about it,
Of
but
course.
these are the very key things. So you have to keep actually very much in the forefront of implementation. And you don't ship a raw AI into healthcare.
Yeah.
You ship a constrained intelligence. And ultimately, AI confidence should never exceed the clinical judgment.
Mm.
just think this much and build products around it. You'll get a lot of partnership for healthcare systems. Healthcare is really looking for innovation at this point of time. Health systems are very open and investing. You're gonna love it. Means we just last week recorded our episode about
Yeah.
how health systems are investing in innovation. They're becoming venture capital. They're becoming incubators of innovation, especially tech innovation. So during that one, we were just talking about like how healthcare systems are very much open to supporting anyone with a good idea and then the
Mhm.
focus, but you have to be very much within the bounds of the basics
Yeah.
of the guardrails.
But also making sure that the implementation is done correctly. Because I know we talked about this earlier. There's so much innovation, a lot of people with new ideas and everything, but the implementation integration within those systems is like so critical. And a lot of people don't seem to be able to do that, which is like step number one,
Mhm.
making sure that you have like all the utilities before you start building the structure of the house for the analogy that you
Right.
mentioned.
um, uh, Integration is a word a little bit confusing, so I do want to, like, for your audience, I do
Sure.
want to actually like bring it up one a big clarification. Most of the time, especially in the tech domain, we use the word integration, we think like two pieces of software actually
Yeah.
talking to each other. It's an API or an endpoint with the
Hmm.
authentication token being able to actually pass on the data, or HL7 language for different interfaces passing on information. But my definition of integration is a little bit broader.
Okay.
And when I talk about the integration, one obviously core is like being able to integrate technologies, but integration into the workflow is way more powerful
Hmm.
and more important, and it can make or break your product than actual basic integration with the software itself.
Yeah.
So if you would have in any other platform, in any other industry, you would actually like build a product and your focus will be around product, and then people will change their ways of doing thing based on your product.
Mm.
But the healthcare is a lot of pieces put together, so
Yeah.
you can't really actually like have them replace all of them just for your product itself. So
Yeah.
that's where it's very, very important that you build your product to be deeply integrated into the workflows
Mm.
as humanly as possible.
So not just like that, the software itself or like the API, like the workflow is like very critical from what I'm hearing.
Absolutely means if you're building, let me give you an example. Like if you
Yeah.
are building an objective measure that actually assesses how well the patient is performing, right?
Mm.
And then you say, I'm going to collect the first data point from the patient, and then I'm going to actually collect the second one as well. But by the time you say, I'm going to collect the first uh, baseline of the patient,
Mm.
and if it is supposed to happen when the physician is deploying that battery or survey or patient reported outcome uh, in the session, if you've already done the intervention, your data collection is already biased. You've
Mm.
already delivered a value, and then after providing it. So, in order to create this integration of simple tool that will take your baseline and compare over time progress to it, but if you don't align with the workflow, that means before the patient gets in and starts seeing the care provider, patient must have given you the baselines of it. Now, because the moment you start talking to a clinician or provider, they start providing you value. And
Yeah.
now I'm already creating a bias in your baseline. So that's a great example of
Uh-huh.
like how understanding workflow is very, very important and critical, and then
Yeah.
based on that having your product deployed. So the easiest difference would be is instead of like providing an iPad to the physician or a clinician to
Mhm.
administer this outcome survey at the during the intervention or session,
Mhm.
I would personally take this example and then ship it over to the patient by an email a day before.
Mm.
Or have them finish it in the lobby before they even actually like see the clinician.
Yeah.
Now you have a true baseline. So everything that you do from this point on will be contributing to the patient's success, and then you will be able to contribute that success to your product at the end of the day.
Interesting. So you have to make sure you get the correct data within the machine, to put it simply, because you're just
And
gonna
then,
have biased data in the end. It's gonna mess up everything.
and at the right time.
Right time. That's correct. And another one would really be curious to hear your thoughts here, because when we think about these major health organizations, systems and everything, they're really prompted. Like they obviously want innovation, but they're a bit stuck in the past, like with the systems that work for them. Like, hey, things work well for us. Like maybe we don't need to be switching or trying to do AI or anything like that. And from a leadership and operations standpoint, one of the things that a lot of executives, I'm assuming, want to know is like, what's the ROI? And like, how do we get
Mhm.
there without trying to turn down like the whole organization upside down in the process? Because there's so many workflows, integration software they're using for like health systems that are evaluating like virtual physical therapy or like any AI tools. Where does like the real return actually come from? And how would you say that you want to build towards it in a way that doesn't disrupt like the care of delivery? Because you mentioned yourself, you want to make sure that everything in the workflow works smoothly. Because if you don't, then you have to start pulling pieces apart, and it just ends up
Right.
become a mess here.
Right. In healthcare, ROI doesn't come from adding features.
Hmm.
So that's for sure. It comes from reducing friction on how well your product can be used
Okay.
and where and when your product can be used. The return shows up in three areas. One, obviously, revenue capture.
Hmm.
Second one is operational efficiency and access expansion. And I'm a little bit biased towards the access because I'm on an AI, digital health,
Yeah.
and telehealth side of it. But yes, those are the main things. You open a new hospital in the area, you're providing better access. You're actually like creating a time motion study to reduce 20% of the time for same task or activity. Your operational efficiency is going to get higher up.
Yeah.
Revenue through better coding, remote monitoring reimbursements, efficiency through reduced documentation burden. These are the admin tasks.
Hmm.
Lower burnout and access by shortening the wait times. This is like
Yeah.
another way of looking at it. We're not adding more work, but like we're seeing the problem from a different perspective.
Hmm.
So if you take 20 days to get in a first appointment with your clinic, that's the lost opportunity right there.
Yeah.
So in any other industry, it would be so simple and easy to say, why don't you just hire one more clinician? And then now you can actually start seeing those patients if there is a line
Yeah.
outside. But by the time you get one of your clinician credential, it can take 3 months to 6 months.
Hmm.
And there's nothing you can do before that.
Yeah.
So there are many other things like that impact. But the point is, you have to put all your effort towards the larger
Hmm.
problem with the best ROI. And also, some products are built for very specific outcomes.
Yeah.
Um, I'm going to repeat again is the key is implementation. If your tool requires a massive behavior change, adoption fails.
Hmm.
If it reduces the workload inside the existing workflows, ROI follows.
Mm.
And that's the key.
I love that. So implementation key. Everyone heard that. I love that. And for like anyone that works within a maybe a health system organization, is there any maybe like if you were to just give them two, three like bullet points that they could
Mhm.
do in the next, I mean, I know healthcare is not the fastest industry, so we'll say next couple of months, maybe like the next year or so when it comes to improving the patient experience, streamlining the operation to provide more value overall. Any like two, three bullet points that you think you would give them as advice? It could be very simple, it could be very in depth. I can give you a couple of seconds if you wanna give us an amazing answer. And I'm putting you on the spot here.
No, that's an incredible question, actually. It's just like there's so many thoughts. It's hard
I
to
know.
put like the top three on there. But yeah, I would bring it down to one and most important thing is understanding
Mm,
of how the consumer uses your product,
mm,
when they use your product, and then why they would use your product. If you can figure out this before you even write a first line of a code, you are on the right path. Unlike many of us founders, where our focus is on building features, and because you didn't like the one that was already available out there, or you thought like this is a game changer
yeah,
product, there's somebody already out there building it and building it better. Unless you have at your core of your product itself, like these three questions answered very, very well.
yeah. And I feel that follows exactly what you were saying in the beginning of our conversation, that you need to make sure you get the utilities first before you start building the foundation and structure. Like you need to be asking yourself these questions before you start building something that maybe no one's going to use in the end, or it's not going to be adopted because it's way too complex and it's going to affect too many things in like the workflows of this system here. But no, I love that. And really thank you so much for being here. I mean, you're like an healthcare expert. I'm obviously not by any means, but I've enjoyed our conversation. On for anyone that wants to get in touch with you, what's kind of the best way? I know you started your podcast recently. You mentioned episode number 2 just came out. You started
Yeah.
pushing out some content on LinkedIn. You have your website, but any specific places people should be looking out to catch you on, or
First of all, I appreciate the conversation, Zach. And for anyone interested in expanding access to care or responsibly implementing AI inside clinical workflows, you can learn a lot more about what we have been doing here at TheraNow at our website, theranow.com, THERANOW.com, or connect with me directly on LinkedIn. I'm pretty active there. Um, we're focused on building infrastructure inside health systems, not just softwares. I'm always open to conversations with leaders who want to move healthcare forward thoughtfully. And I'm trying to build a platform where we all can come together and have conversations and not only share great ideas, but also let others learn from anything that we can actually share to the world.
that. So we're gonna add that in the show notes if anyone wants to get in touch. But if anyone wants to get in touch, theranow.com if you want to learn more. To your listeners, if you've enjoyed this episode, don't forget to subscribe, leave a comment. You can also find more insights at wefuture.com, where we're dedicated to helping entrepreneurs build their thought leadership in business by getting them on podcasts and launching their own podcasts. Until then, keep pushing, and we'll see you in the next one.